Jenna?
Yes. Hi.
Hi, my name is Melinda Keene. I'm here for the interview.
Hi, Melinda. All right, well, come on in.
Thank you. I also have a copy of my resume and a couple letters of recommendation and references for you.
Wonderful. Thank you.
Your facility looks amazing.
Oh, thank you.
Yeah.
It's been a lot of time and hard work putting it together, so I'm glad that that paid off. Alrighty, so just to start off, can you tell me a little bit about yourself?
Yeah, so I graduated from Ithaca College. I've always, from a young age, been very passionate about health and wellness and helping people. And I feel like I've carried that throughout my college career. During my undergraduate years, I was on the crew team. And I think that that's the thing that I did in college that shaped me the most. I was a coxswain, so right from the beginning, I was put into kind of a leadership role. And I had to learn to motivate my growers to strive to be the best that they can be every day. I learned a lot of time management, balancing my course load with crew, and I really learned the power of being on a team that will not function if everybody isn't working 100% together. So I think that those are some of the things that I've learned about myself throughout my education.
Oh, that's great.
Yeah.
Alrighty. So can you tell me just why you're interested in this position? I guess what interests you the most?
Yeah. So I'm really interested in working in a rehab hospital. So this has been something that I've kind of looked to do upon graduation for a couple of years now. I really am looking forward to working with a variety of patients and different diagnoses. I think that the thing that interests me the most is, again, the teamwork aspect and being able to just work in a team and being able to work with therapists that use some of the highest quality technology, the newest treatment techniques and things like that. So I'm just really looking forward to working with a group of therapists that have all those skills to really provide that patient-centered care.
Great. Okay. Let me see. So you can tell me about some of your strengths and some of your weaknesses.
So some of my strengths, I feel that like I said, for crew, I learned to motivate people a lot. So I'm a good motivator. And I think that that really will translate into a career in physical therapy because patients will need to be motivated a lot of times, and they'll need somebody to tell them that they can do it and they can get better. So I think that that's one of my strengths. I also became very good at time management, so I think that with crew helping me with that, I'll be able to manage the busy patients, the busy schedules, as well as all of the documentation that goes along with it. So I think that I'll be able to be very efficient in your clinic. I'm also really good at communicating, both with patients, with other healthcare professionals, and that kind of goes along with that team, the team aspect. Some of my weaknesses, I do tend to be pretty self-critical, but I find that throughout graduate school, I found that I couldn't necessarily spend too much time rechecking my work. So I've learned to really trust myself and to know that the quality of my work is the best that it can be without really being too critical on myself. And then sometimes I am a little bit shy. I do lack confidence, but I am also working on that, and I have been working on that through my clinicals to really try to know that my schooling has been good enough and that I do possess the skills, the communication, and the clinical experience that it takes to be the best provider that I can be.
Sure. Very good.
Yeah.
So where do you see yourself in 3 to 5 years? And that seems a long way away.
No, not at all. So I see myself becoming an established therapist, hopefully with your company, with Health South. I also noticed that you guys do a lot of work with Parkinson's patients, and I really am looking to become BIG certified, so maybe taking some continuing education classes for that. So I'm really just looking to grow in the profession of physical therapy, to just be in this kind of setting where I get to see and I'm challenged by several different patient populations, diagnoses, things like that.
All right, very good. So you've gone through a couple of clinicals now, and you must have come across a challenging patient at some point. So can you tell me a little bit about an experience either with a patient or with a faculty or staff member that was challenging to you, and kind of how did you tackle that? How did you make it work?
Of course. So my first clinical of Phil, I hadn't taken any neuro courses or anything like that. So we had a patient that he had Parkinson's disease, muscular dystrophy, and he had just fractured his ankle. So I knew a little bit about muscular dystrophy and Parkinson's disease at that point, but I didn't really know about the disease process, what happens. So first I went home and I just did a bunch of research on Parkinson's and muscular dystrophy and kind of how they affect different systems of the body and what the clinical presentations are. And then I noticed that for the first time, because you've always been working with students, your peers in classes and things like that, that for the first time ever, a patient really depended on me for their safety and a lot of their mobility. So I really worked with my CI. She helped me along the way. And together we were able to, along with me asking all my questions that I had to, we were able to really provide that patient with the best care that we could. And so he actually ended up doing really well.
Good. That's great.
Yeah.
Very nice. So it does seem that you have a passion for Parkinson's disease. Are there any other types of patients that you like to work with?
Yeah, I also saw that you guys have an amputee rehabilitation program, and that's also been something that's interested me, although I'm really looking forward to, like I've said, to work with several diagnoses, several different patient populations like that. So.
Okay, very good. So that's pretty much all of the questions that I have for you. Do you have any questions for me?
Yeah, so I saw on your website that you offer continuing education courses. So I was just wondering kind of what courses therapists at your facility have gone to in the past, if you offer any benefits for those.
Yes, we do offer some benefits for continuing education courses. We think that continuing education is very important, so we do want to encourage our therapists to go out and take those courses and bring that knowledge back to our facility and give better care. So we do offer benefits for that. We usually, we can lay that out in a package. Once we go further through the interview process and things like that. Some classes that our therapists have taken. There's a vestibular course that has to do with balance, that has effects with a lot of our patients and their population. So that was a popular one with some of our therapists. There are classes for Parkinson's disease that a lot of our therapists have gone to. So those are kind of the areas, that our therapists seem to have gravitated towards, but there certainly are a wide variety of courses that they've attended.
Yeah. And I was also just wondering what a typical caseload for a beginning therapist that you guys have, a new graduate. So how many patients in a day would I see at your facility?
Sure. So we, for brand new therapists, we usually would start you off trying to have you with about 10 patients per day. Okay. Personally, I am a big fan of seeing one patient at a time and not having to jump back and forth between a whole bunch of patients in a day. Right. So, seeing as many, you won't see as many patients as you would in an orthopedic outpatient clinic. Right. I also think that when you see one patient at a time, you get a lot more attention, with that patient, exactly. And they see that and they feel that, and I think that has an impact on their recovery. So. About 10 per day, and then as you get used to how our facility runs and you get used to being a full-time therapist and things like that, then we can see about increasing your caseload.
Okay, perfect. Okay, I think that's all the questions I have for you.
Okay, great. Alrighty, well, Melinda, it was very nice to meet you.
Yes, thank you. Oh, do you have a business card?
Yes. There you go.
Thank you so much for taking the time to interview me.
Of course.
I really appreciate it. I look forward to hearing from you.
Yes.